welcome to We the People. I'm Gargi Rawat. Last week, we began a very important conversation around women's health. What is the human papilloma virus? How is it linked to cervical cancer? And how can we protect our girls starting as young as age 9 with the HPV vaccine? We also learned that boys should be vaccinated as well. Today on this program, we're shifting our focus to women between the ages 18 to 45, for whom the HPV vaccine is just as effective and just as necessary, especially when you consider the fact that cervical cancer is the second most prevalent cancer among Indian women, and that according to the World Health Organization, 1/5 of cervical cancer cases are recorded right here in India. That HPV-related cervical cancer can strike at one of the most productive periods of a woman's life, and that roughly 3 out of 10 young mothers are at high risk of HPV infection and related cancer. So we're going to talk about all these issues today on the show. To talk more about the importance of preventing HPV-related diseases, we're joined by Dr. Shyam Agarwal, Head of Department Medical Oncology, Sir Gangaram Hospital. Thank you so much for being with us. Dr. Neerja Bhatla, Vice President, Federation in Obstetric and Gynecological Societies of India. Dr. Pankaj Garg, Vice Chairman, Department of Neonatology, Sir Gangaram Hospital, New Delhi. Thank you for being with us, Doctor. Also, Poonam Kamdar, who is a psychologist by profession, also a survivor of cervical cancer, and later we're going to hear about your experience. Dr. Bhatla, I'd like to start with you. When we talk about HPV, we talk about cervical cancer. If you can explain to our viewers, our audience, what is HPV and cervical cancer, and what is the link?
So HPV is a virus, human papilloma virus, which is a very common virus. Just as most women have had a flu, or in fact all, but at least around 80 to 85% of women will get this infection at some point in their lives. And most of them will clear the infection by their own immunity, just as we clear the flu. But about 10% of women will be left with what we call a persistent infection. Now, some of the women who have a persistent infection will go on to develop a pre-cancer. We call it CIN, cervical intraepithelial neoplasia. And this can progress through its stages of CIN 1, 2 and 3 over many years to become eventually a cervical cancer. So not all women who have an HPV positive test are going to develop cancer, but we have to find out who are those women, and more importantly, we now have vaccines which can prevent that infection. The infection continues to come in, incident infections, new infections keep coming in throughout a woman's life. So it's not just at any one point that they are at risk. They remain at risk of getting infections and keep clearing and acquiring.
Doctor, one interesting point, or misconception, people get confused with cervical. We're talking about the neck of the uterus when we talk about cervical cancer, and then you have the cervical pain that we have at the back of the neck. So if you could just clarify
very important.
that.
Many people say, oh, you about cervical cancer, cervical is so common these days. But no, cervix means neck. So here also it means cervical refers to neck, and we talk about the neck of the womb, which is the point at which it opens into the vagina, which is the part which the doctor can easily visualize when they put in their instruments.
Dr. Garg, if you can talk to us about what are the potential benefits of the HPV vaccine. One has heard, early on we used to hear about how one must get it in the early years and you may have missed the bus, but now you can get it at later stages of your life as well.
Right. So it is true that if you get it early, it is more efficacious because you are not been exposed to that virus ever in life, and that is called naive population, which never got infected. But does not mean at the same time that you will not get infection later on in life. You keep on getting infection, probability of getting infection every year throughout your lifespan, especially in the reproductive age group. So it's important that you should catch them early preferably, but it does not mean that you have missed the bus, and you should be able to catch them whenever it's possible. It's also important to know that this disease, cervical cancer for example, can strike you when you're most effective in your life, you're more productive in your life. Average age when cervical cancer presents around 38 years. That means you are not still that old to get a cancer and then get a disease.
Not old at all.
At all. That's what we say, that you should try to catch them early as possible, but does not mean you cannot catch them later, and vaccine is effective. That is why you should be able to have preventive strategies right throughout that age group.
Right, Dr. Bhatla, if you could just add to that about young mothers as well, and what are the benefits of getting the vaccine?
Yeah, before that I just want to say that human papilloma virus actually has about 100 different types, and they are very tissue and species specific. So about 30 to 40 types which are affecting the anogenital tract, and about 14 out of them can cause cancer. And the most important, we target 16, 18 in the first generation vaccines. Now we have added another 5 types, so 7 types in the new generation, 2 types which cover the warts. So it's a spectrum. And it's not only cervical cancer, you actually get protected against some other cancers also, like vulval, vaginal, anal, penile, oropharyngeal. So it's actually a benefit you get beyond cervical cancer, but because that is the most common problem, and because the cause of, being caused by HPV is maximum for cervical, hence our thrust is on cervical, but that's why there are spin-offs for women as well as for men.
Right, and this aspect of the man, this gender neutral aspect of the vaccine, also very important to emphasize, isn't it? So what are some of the challenges you face when you discuss this with your patients, when you talk to them about HPV?
You know, sometimes there is a tendency to believe it's not going to happen to me. Cancer is something that happens to other people, but people don't necessarily accept it and don't think that they are going to benefit. They think it's something they're spending unnecessarily on. So that is the first thing, that there is this stigma also, that maybe because we know that cervical cancer risk increases with those who get married early, who have more children, who have infections, and there's a general stigma around anything associated with the genital tract. So people just want to shelve this discussion and not think too much about it. But I think there's ample data to suggest that we are all at risk and that we should all accept the vaccination and go for screening. For the older women, screening is very important, because the primary target group, what Dr. Garg spoke about, is up to 15, but others come as secondary target. Once they have become sexually active, the efficacy will decrease. Screening is vital.
All right, and Dr. Garg, I know we're talking about women and getting the vaccine later on in life for young mothers as well, but for parents who are watching, if you could just emphasize how important it is for children to get vaccinated, and at the earlier, post 9 years is when you should get vaccinated.
So we are saying that before you get exposed to the infection, if you are vaccinated, then the vaccination is very effective. The minimum age when the vaccination can be started at 9 years of age. And it is a dual benefit from our academy. Our Indian Academy of Pediatrics has laid down criteria that if you are vaccinating between 9 to 15 years, you only requiring 2 doses of the vaccine. Beyond 15 years, then in case you require 3 doses. So there are 2 benefits. One, that the protection is complete. Other is that you are using lesser doses, lesser pain, lesser cost also. Apart from that, I think one thing which I want to emphasize is it's not that it's only about HPV vaccines what adults don't want to take. Adults are not very pro-vaccinations. They are very pro-vaccination as far as children is concerned. They will bring their children for vaccination, and 6 times in first year minimum, and then also 5 to 6 times every year, and after 2 years also every year. But if you ask them to get vaccinated, they are not that prone. So as a whole, adult vaccination program is yet to take up in our country, and HPV is one of them.
Right, Dr. Agarwal, if you can, add to that about the ideal age is, as we know, as a child to get this vaccine, and 9 years and beyond, but also in adults. If you can just talk about your experiences and what you have to say to the viewers.
Right, Gargi. So I think, as has been pointed out, between 9 and 15, 2 doses of, the vaccine which covers, say, for example, 4 HPV virus strains is sufficient. But if you have to vaccinate beyond 16 years, the guideline is to take 3 doses. One is at the 0, level, then at 2 months, and at 6 months. And if somebody has missed, then the vaccination should complete within a period of 1 year. So as Dr. Neerja was suggesting, there is an additional vaccine which covers, another 7 types of HPV. So the point is that, you may be exposed to one virus, in your life, but then the more number of viruses which are covered in the 9 virus vaccine will give you the cover. But yes, of course, you have to have those 3 shots, as I said, at 0, 2, and 6 months in women who are beyond the age of 15, 16 years. So I think one needs to discuss this with the gynecologist.
All right, Dr. Bhatla, when we're talking about adults getting vaccinated, what are some of the challenges you face? What are some of the concerns or misconceptions that people have around this?
So I think there have been a number of anti-vaccine statements around this vaccine, and because we are generally promoting it as a vaccine for girls, it seems to raise concerns as to why only the girls. Are you looking at targeting their fertility?
And the fact that it's connected to when you become sexually active, does that
and
create
so
some
are you
sort
targeting their fertility?
doubts?
Is there some scheme to get the girls not to have? Or will it as a side effect lead to premature ovarian insufficiency? Recently that has done the rounds a lot. So we have actually been in a trial with the WHO with the original first generation 4-valent vaccine, which we have had an extensive trial in India since 2009, and we are still following up those girls. So apart from what is there in published literature, we have our own experience of a large cohort of 17,000 girls, and we have seen no adverse effects in the girls which are more than what are in the general population. And there are large systematic reviews and meta-analysis which have shown there is no risk which is more than in the general population. Specifically for the premature ovarian insufficiency, they have compared the quadrivalent, bivalent, nonavalent, all types of HPV vaccines with other childhood vaccines and found absolutely no concerns. So in fact, CDC in USA has said it is as safe as a tetanus toxoid.
Right, I think the COVID years have created a lot of, misconceptions and fake news. Dr. Garg, we're talking, and you have to deal with this challenge with parents and their misconceptions. So, and there's this whole, misconception about it affecting the menstruation in a girl, etc., etc. So, if you could tell us a bit about that.
Right, I think challenges are similar, that they feel that why are you targeting only girls, number one, which has been now demystified, because we are saying that it's vaccine both for boys and girls. So we are using it for between 9 to 15 years for boys as well. And it's also important that people who come to us may say that we will start vaccination only after menstruation starts, because that is another concept. We are trying to tell that earlier you vaccinate, better is your immunity. We know that it's not that 9 to 15 years, there are 2 doses because you are not exposed. The main reason of 2 doses between 9 to 15 years is the immunity is stronger. You only need 2 doses to get an immune response. As you get older, your immunity becomes also weaker. So you need to have 3 doses to mount a response. It's not only exposure, it is immunity. So earlier you get, it is better. Menses is not a concern.
If you're vaccinated as a child, you don't need a booster when you're older.
For this vaccine, we have a trials up to 12 years, which has been done on serological markers, that it does not need a booster as of today. Science is evolving, we don't know for future, but as of today, you don't know boosters are required. So menstruation is one, and lactation is another one, because we don't recommend this vaccine in pregnancy for sure, but those women who come to us and we are recommending it to them, they feel that whether I am lactating, it will affect my baby. That is also not true. It does not affect lactation, does not get into the milk, does not affect the baby at all.
All right, that's important to know. Dr. Agarwal, if you can talk to us about the types of vaccinations that there are, vaccines that there are.
So basically, the bivalent, 4-valent, and the 9-valent. So these are the vaccines which are so kind of readily available, and the 4-valent is targeting 2 HPV viruses which are responsible for benign conditions like warts, and the 16, 18 are the HPV which is responsible for occurrence of cervical cancer. So in the 9-valent one, you have another 7 types of HPVs which will target those HPVs which are responsible for causing cervical cancer.
Right, that's interesting. Science is evolving. Yes, sure.
Right now, the bivalent vaccine has been withdrawn. So right now, we have only either quadrivalent or a 9-valent vaccine which is available, and rest all is fine that we can use either.
All right. Well, then now coming to you, ma'am, Poonam Kamdar, you're a cancer survivor. You had cervical cancer. You could share your experience with us.
Okay, it was in 2015 I was diagnosed with cervical cancer और बड़ा इंटरेस्टिंग इंसिडेंट शेयर करती हूँ इसमें. मैं डॉक्टर के पास गई थी, मतलब काफ़ी फटीग रहने लगा था एंड आई वाज डूइंग माय हाउस होल्ड चोर्स एंड अदर माय प्रोफेशनल वर्क आल्सो, बट फिर भी बड़ी टायर्डनेस होने लगती थी. एक टाइम के बाद लगता था कि बस जस्ट लेट जाओ पैर को ऊपर करके एंड ऑल. तो लाइक जब टेस्ट कराया डॉक्टर ने कहा कि पहले डीएनएस का हुआ, उसके बाद और भी उसके बाद कहा कि रिपोर्ट इज़ नॉट ऑल दैट गुड. बायोप्सी के बाद जब रिपोर्ट आई तो लाइक डॉक्टर सेड यू डू यू हैव समवन हियर विद यू, या किसी को लेकर के आओ. मैंने कहा नहीं डॉक्टर आप बताइए क्या हुआ है. डॉक्टर शेयर विद मी दैट दिस इज़ कैंसर, सर्विकल कैंसर. तो लाइक कुछ नहीं, कोई फीलिंग नहीं थी ऑनेस्टली स्पीकिंग. वो फिल्मी अंदाज में पूछा डॉक्टर साहब मेरे पास कितना समय है, जैसे पिक्चरों में देखा है ना उस तरह का. तो लाइक डॉक्टर ने कहा यू हैव सम टाइम बट डोंट डिले द थिंग्स एंड ऑल. आप यू हैव टू गो टू दिल्ली बेसिकली एंड फॉर योर ट्रीटमेंट और सम अदर प्लेस, वी डोंट हैव अरेंजमेंट ओवर हियर. तो दैट वाज वन थिंग. देन आफ्टर दैट तो पता ही नहीं चला टाइम कैसे निकलता चला गया. डॉक्टर्स के पास जाना, एक करना, जो उन्होंने कहा. लाइक फर्स्ट थिंग दैट आई डिड इज लाइक इन माई द एंटायर फैमिली डिड इज listening to our doctors. I had full 110% trust on the doctors, what they said. आपको ये कराना है, इस दिन आना है, ऐसे कराना है. And that is one thing. And another thing is doctors ने ट्रीटमेंट के दौरान भी और बाद में भी जो डाइट बोली, I followed everything. मतलब नो इफ्स एंड बट्स, नहीं अच्छा लगता खाना है, वॉक करने को कहा है, पेन हो रहा है, स्टिल गो इन फॉर, बिकॉज डॉक्टर्स दे वर लाइक जो कह रहे हैं मेरे को अगर मैं मानूंगी तो मैं बहुत जल्दी ठीक हो जाऊंगी. एंड बिलीव मी येस इट वर्क लाइक मैजिक. तो इस दौरान जैसे कि था कि लाइक आई वाज ऑपरेटेड अपॉन एंड देन हैड 28 cycles of radiation, then 2 cycles of brachytherapy followed by 6 chemo cycles. तो पूरा 6 महीने तक स्प्रेड आउट होता रहा. पता नहीं चलता था उस समय पे. फिजिकल स्टेट अगर अपना बताऊं तो मेंटली कई बार तो बड़ा इलेशन का स्टेट होता था कि किचन में गए, कीमोथेरेपी के बाद आए और डोसे भी बना लिए, ठीक है, फिर उसके बाद सल्क कर जाती थी एकदम. और
it's difficult going through cancer treatment. Yes.
It was, but I don't know कहाँ से एनर्जी मिलती चली गई. My mother was there with me, my sister was there. मतलब एक लगता था कि अगर आपको थोड़ा गुस्सा भी आ रहा है तो you have the people who are significant in your life जो आपको जज भी नहीं करेंगे, आप उनके सामने कुछ भी कर सकते हो. That was one thing. फिर टेस्ट बड्स बिल्कुल ख़त्म एक तरीके से हो गए थे, बट भूख लगती नहीं थी ऑनेस्टली स्पीकिंग. बट खाना था क्योंकि डॉक्टर ने कहा था हाई प्रोटीन डाइट लेनी है आपको, वॉक करनी है, एक्सरसाइज किसी भी फॉर्म में आपको करनी है. अच्छा, आई जॉइंड वन ऑफ द दिस थिंग लाफ्टर योगा जो कि टीवी पे चल दिखता था, तो मैं उसको करती थी. तो थोड़ा बहुत दैट वाज अनदर फॉर्म ऑफ एक्सरसाइज.
Thank you so much for sharing your experience and the fact that it got detected, and we're so happy to have you here talking about it. So your message to women, to parents about, since we know that there is a vaccine that can 99% I'd like to say prevent cervical cancer from even occurring. So if you could talk about that.
Yes, first of all बिल्कुल भी डरे नहीं. और ये मतलब वैक्सीन इसको ज़रूर लगवाएं. मतलब इसमें डरने वाली कोई बात नहीं. प्रिवेंट अगर आपने कर लिया ना, बहुत सारी प्रॉब्लम से बचोगे, कॉस्ट के टर्म्स में भी, और आपके हेल्थ और अपना मेंटल जो एगनी होती है ना, जो उससे जो आप गुजरते हो, और आपके फैमिली मेम्बर्स जो गुजरते हैं, उससे आप बचोगे. तो लिसन, आप जाइए अपने गायनी के पास, आप डिस्कस करिए और ज़रूर लगवाइए. डोंट डिले दैट पार्ट, क्योंकि डिले में कोई भी आपको बेनिफिट नहीं होना है. तो मैं सपोर्ट ग्रुप से भी जुड़ी हुई हूँ, वहाँ पे भी मेरा यही मैसेज होता है कि आपने लगवाया क्या, आपकी डॉटर इतनी बड़ी है, इसको मतलब थोड़ा बहुत जो मैं बता सकती हूँ. अदरवाइज आई रेफर टू द गायनेकोलॉजिस्ट ऑल्सो फॉर द डिटेल्स एंड ऑल, कि आप बात करो उनसे. तो इट इज़ अ मस्ट कि यू गो इन फॉर द वैक्सीनेशन पार्ट. और अवेयरनेस के कुछ बहुत सोसाइटीज़ में होते हैं, जैसे दिस इज ऑल्सो वन ऑफ द वे ऑफ क्रिएटिंग अवेयरनेस. तो क्या है कि आप सुने, बिकॉज दीज थिंग्स आर हैपनिंग, हो रही हैं हमारे आसपास में. वाई टू टेक अ चांस एट ऑल.
Right, Dr. Batla, so interesting to hear her experience, and as we said, prevention is better than the cure. Absolutely. And that must be the message that you give as well.
It has indeed been a wonderful thing to meet Poonam and to see her positivity, the way she accepted the diagnosis, surrendered to the situation, followed the directions, had the family support, was not constrained by lack of finances or anything. which can be a real challenge in many cases. You know, as Dr. Garg very rightly said, that they are young women. Years of life lost to cervical cancer are more than with breast or ovarian cancer. They have young families. We have seen them lose their jobs. We have seen their partners lose their jobs. We have seen relationships break up. We have seen families turn away. Anything and everything. But what I say is, we keep talking about preventing cervical cancer, but you actually even want to prevent the CIN. We have a lot of patients these days who come to us even from the infertility clinics, because the age is increasing at which people plan childbearing, and when they go for their infertility treatments, they discover CIN. The whole thing gets sidetracked. Now they are getting procedures done for that. And we have even seen the miseries of even getting a positive report of HPV. Why did I get it? How did I get it? And all kinds of sidetracking. So what I say is, to the young people, you need to get vaccinated.
So if we can talk about you know, the health implications of HPV infection in young mothers if they get HPV.
So HPV is a very silent infection. People who have HPV don't know that they have it unless they get tested for it, because it doesn't produce florid inflammation or anything like that. Of course, if there is an infection in the tract and the woman has a birth, there is some risk, and Dr. Agarwal can talk about that, about the neonate getting some infection, which may, again in most cases, be transient. So it's not something that the woman may perceive. It may be, even the cancer may be asymptomatic early, or there may be some symptoms which are specific to that, but as such, not.
All right. Dr. Garg, if you could add to that, and because you must be interacting with lots of young mothers as well.
I think first is the opportunity. So at that point of time when a woman has delivered a baby, she is very, very important to the family. So is the baby. So they are health seekers at that point of time. They are coming to a neonatologist like me or a pediatrician very often because of baby's concerns. And one question which I ask them is that, is this baby important to you? She will say yes. Then I say, are you important for the baby? She will say definitely yes. So that is the point of starting discussion, that you are very important for your baby and your health is also very important. You are coming to us 6 times in first year for your baby's vaccination because you are worried about tetanus, pertussis, polio and all. But your baby is also worried about your health. Have you taken these?
Because women don't, in India, we tend to not take your health as
seriously,
priority.
Correct. And that's point of time, they're very pro-vaccination. We as neonatologists see that babies who are admitted in NICUs for long period of time, people keep on asking, what will happen to their vaccination? He has missed his 42 days vaccination. So when are you doing that? So they're very pro-vaccination for children. So we utilize that opportunity to emphasize upon that for your baby, you are the most important person, and your health is also a very, very important aspect. So where is your vaccination chart? Whether you have taken HPV vaccination, whether you have taken other adult vaccinations which are also very important for you. And we also know in postpartum period, they are more prone to HPV infection because of hormonal changes, cervical lining become thinner, you are more prone. And if a woman gets, as Dr. Bartla is saying, gets infection before pregnancy, it can go to the baby also, though that is not very important part. It normally is a transient thing, but it's very important to emphasize that. And we also plan that way. 6 weeks, every baby is coming for vaccination. So at 6 weeks, we give 1 dose to the mother. Then they again come to us 14 weeks, they get the second dose, and 9 months they come again, we give the third dose. So we have planned our vaccination schedule for mothers also in such a way.
Capture the mothers during that time.
They are coming to you anyways. It's just to emphasis and just to make it sure that they're getting vaccination in time.
Right. Dr. Agarwal, I saw you were nodding there. If you'd like to add something, and as an oncologist, you know, it's so, I mean, you see so many cases of cancer, and one wishes it could be prevented.
So the strategy which has been proposed, which should be highlighted to the people, is that 90% of the girls by the age of 15 must be vaccinated. But the date has not come so far as to when that initiative will be taken up in our country. So I think we need to take a step in that direction. The second global strategy is that the 70% of women should be screened between the age 35 to 45 years. And the third is that the 90% of the women who have any cervical disease must be treated adequately. So you need to have that global strategy implemented in our country in order for us to take a step towards elimination of cervical cancer in India.
That's right. Dr. Nija, if you could tell us about in other countries, it is something that's eliminated because they're very conscientious, they're very particular about getting the vaccine, which is what we'd like to have here as well, this sort of, awareness around this and people, going in and taking that vaccine.
Yes, I think the first country which is heading towards elimination is Australia, which is where the vaccine was actually developed first. And they were the earliest to put it into their national program because the Prime Minister's wife, who was herself a survivor, had supported the fast tracking. They followed processes but fast tracked introduction. And then they went on to make it a gender neutral vaccine. So the boys are also covered now by the national program. And in fact, you may have heard about recently our Prime Minister's announcement in the Quad Moonshot Cancer Initiative for the 4 countries, where India has also pledged vaccine and diagnostics donations, and Australia has promised to help the Indo-Pacific reach their goals very quickly. And so there are many countries which are getting, their rates reducing, and countries like Sweden and UK have actually analyzed the real world impact of introducing vaccination and found that it was the best reduction, 88% in the women who got it before they were 17 years old, and at least 53% reduction even in the older age groups. And UK has also seen great reductions in the girls who got it before 13, the highest, and correspondingly in the older age groups as well. So there's a lot of countries now which are working quite sincerely. I think this WHO's call for elimination has put a lot of impetus, and new diagnostics for HPV tests, new vaccines are constantly coming up. And we have the Cervical Cancer Elimination Initiative anniversary on the 17th of November. So it will be great if everybody does what they can to promote the awareness and to take the vaccinations and screenings and for themselves and their families, and maybe even do donations to less affording people and get the momentum going.
Right, that's important to take it to other parts, people
Yes.
who may not have access to it. Poonamji, you shared your experience so wonderfully with all of us. If you could, to viewers who may be watching, who are still hesitant about their daughters, about themselves to get the vaccine, if you could, what is your message to them?
सी वही है, प्रिवेंशन इज़ ऑलवेज़ बेटर दैन क्योर. मतलब आप बहुत बड़ी मुसीबत से बच जाएंगे. मतलब मैंने जो 6 महीने का टाइम पीरियड गुजारा है, ऑनेस्टली स्पीकिंग, मैं जब मिलती हूँ और कैंसर सर्वाइवर्स वगैरह से, इट इज़ वेरी वेरी टफ. शायद मेरे लिए भी होगा, पर मैंने शायद रियलाइज़ नहीं किया. तो एक मिनट लगता है कि आप क्या, मतलब आप कुछ याद करने की कोशिश करते हो, आप पढ़ रहे हो, आपको 2 मिनट में एवरीथिंग इज़ गॉन. आपकी मेमोरी, आप बिल्कुल नहीं याद कर पा रहे हो उस चीज़ को. इमेजिन यू स्टार्ट डाउटिंग योर सेल्फ. ऐसे टाइम होता है कि आपको आवाज़ें अच्छी नहीं लगती. नेचर की जो सिंपल चीज़ें हैं ना, एक आधे घंटे की वॉक, वो आप नहीं कर पाते. मतलब ब्यूटी जो हमारे को मिली हुई है इतनी ज़्यादा, वो सब चीज़ें हम इंजॉय नहीं कर पाते. इन सब चीज़ों को प्रिवेंट करने के लिए डेफिनेटली मतलब इट इज़ वर्थ इट, आई बस से, कि आप एक वैक्सीनेशन के थ्रू आप इतना कुछ अपनी किटी में डाल सकते हो. एंड टेक माई वर्ड्स, लाइफ इज़ रियली रियली ब्यूटिफुल. एक मैसेज मैं उनके लिए भी देना चाहूँगी जो कैंसर सर्वाइवर्स हैं या ट्रीटमेंट जिनका चल रहा है. मतलब लाइफ इज़ वेरी वेरी ब्यूटिफुल. किसी भी फेज़ पे ये नहीं सोचना है, क्योंकि मतलब मैंने तो एक नया वर्जन अपना डिस्कवर किया. छोड़ दो, छोटी छोटी चीज़ें बिल्कुल बेकार हैं. यू डोंट हैव टू केयर अबाउट देम. आप अपने ऊपर फोकस करो, एंड पीपल हु आर इम्पॉर्टेंट इन योर लाइफ, जो नहीं है उनको छोड़ दो बिल्कुल आप.
Dr. Bhatla, we just spoke about young mothers and lactating mothers. There are misconceptions. If you could just elaborate on that, and also young mothers are vulnerable to HPV.
So yes, because that is a time when the transformation zone is, we have a zone on the cervix where changes occur with hormonal effects and all, and that is the area which is vulnerable to get this infection, and that is in a state of transition post pregnancy. And we don't want to give the vaccination during pregnancy, but we can give the vaccination during lactation. It's quite safe. And so that is a great time, because as Dr. Garg very nicely pointed out, the woman is concerned about her health because she is concerned about her baby, and she can be concerned without feeling selfish. So it's good to catch them at that time, and they are already in the fold of the hospital. And there are no real concerns actually associated with it. It's equally effective, it's equally sort of the immunogenic as it would be if it were given post the lactation time.
Well, and Dr. Agarwal, if you could also talk to us about, what are some of the misconceptions that people have brought to you, or what are some of the ideas that they have around vaccine? And as we were speaking earlier, adult vaccination is something that we're not that comfortable with, here in India.
I think one of the concerns which parents had was regarding the promiscuity in girls, after getting the vaccination. So there is no, I mean, this is absolutely absurd, so it doesn't promote any of that kind of thing. Then, of course, lactation, as they've already said, is a safe period where the vaccination can be given. And of course, pregnancy, it is of course no. So the only side effect which happens is the pain at the local site, which goes away in a few days' time. And by and large, it is very, very safe. And I think earlier you do it, the better it is. So 9, 10, 12 years is the right time to do it. So I think by and large, the message has to go loud and clear that the vaccination for HPV is extremely safe amongst girls, and it should begin as early as 9 years.
All right, I saw Dr. Garg, you wanted to add something.
I just wanted to say that it's not only general people who should be aware. I want to appeal to my fellow doctors. I think pediatricians, gynecologists and oncologists, they are very prone for vaccination because we do vaccination, pediatricians they do vaccination against a lot of diseases. So we are always prone. Obstetricians and oncologists, they see cervical cancer, so they are very, very prone for this. But I will request all my physician friends, all the doctors, that whosoever comes to you, whosoever comes to you, after you have taken care of history, just ask this question whether you have been vaccinated. Because vaccination history is not taken routinely by the general physicians, doctors, all specialties. Pediatricians take it regularly.
That's a very important point.
So if they start taking it, it will keep on striking you. Each doctor you go, the patient will be hammered this question whether you are vaccinated. I am not saying only about HPV, there are other adult vaccinations also which are equally important. So once it is hammered in your brain again and again, then you will realize, the patient will also realize that I am missing something which every doctor I visit is asking me. And then he or she will be stimulated to get the vaccination. And I am sure the benefits are so many that asking this question will really sort out a lot of problems.
Very important point. In the medical fraternity itself, there should be more awareness. Neeja ji, you wanted to add something?
So, yes, about the side effects, again, I also wanted to reiterate that we have hardly seen side effects. We have mainly seen pain. Even the redness is less perhaps because our skins are a little bit darker than the Western ones. So, we report less of the redness than people do abroad. And some patients may have a little bit of dizziness. So that's about it. So if there's any young mother who's concerned that she will interfere with looking after her baby, that is definitely not a concern. If she's concerned that she has to time her lactation based on the injection, that is not a concern. And all the other side effects which have been reported sometimes seriously from other countries which have impacted the vaccination programs in due course have been shown not to be of significance.
Yes.
So I just wanted to say that it has been reported that adolescent girls, they have a more chance of syncope or a sudden sense of feeling lightheadedness and chances of fall. So that is why one which we have made it sure that all vaccinations, it is true for all, but specifically for this vaccination, we are expected to stay in the clinic for 15 minutes after the vaccination. And we try not to give vaccination in a hurried way. So just vaccinate, close the clinic and you go home. It has to vaccinate and the woman or the girl has to stay there for 15 minutes because this is something which has been observed, syncopal attacks, and we have to be very sure that one attack, one fall may hamper the process of 10 more people who may come to the vaccination.
But that's just immediately after the vaccine.
So you have to take care that they are taken rest.
We have vaccinated in Delhi ourselves more than 1,000 girls. 17,000 countrywide, systematic data keeping. We have not had even a single one, but because they have been reported, so we take care. We follow that 3-step room policy, keep them in one room first. In the second room, they get the injection. In the third room, they are
wait for it.
observed.
They wait for a
Because
little bit.
sometimes these things amongst young girls can be a little infectious. You see one girl and you start getting a little bit
All
yourself.
right. Well, time for us to slip into a short break. Before we do that, I'd like to know among the young audience members here, how many of you have been vaccinated? How many of you have received the HPV vaccine? Yes. Can we have the hand a little higher? All right. So that just goes to show you one person. We're in the national capital and so many young people and clearly not enough awareness. Just one among our audience has been vaccinated. We're going to slip into a short break and return with more. Stay with us. Welcome back to We the People. We've been talking about the prevention of HPV and the prevention of cervical cancer through vaccination and how important it is. We do know that young children should be vaccinated, post the age of 9 is when you should get the vaccine. But even adults can get vaccinated and young mothers as well. And we've been hearing from the doctors regarding this and how there needs to be more awareness. In our audience here, we have just one person who has received the HPV vaccine, which is very shocking given that we are in the national capital. So one can imagine what the level of awareness are in other parts of the country. But now I'm going to open up for discussion and for questions to the panelists. Yes, go ahead. You have a question.
How common is the HPV?
Okay, how common is HPV? Yes.
It's very common. About 85% of women and 90% of men are going to get this infection at some point in their lives.
All right, and you may have it, you won't even know it, and you could
won't
just
even know
it will move out of your system. Yes, go ahead. You had a question.
मैम मैं ये क्वेश्चन करना चाह रही थी कि आजकल बहुत यंग जनरेशन को ही जैसे डायबिटीज़ हो रहा है या थायराइड की प्रॉब्लम हो रही है, तो कितना सेफ है और ये चीज़ें लेना?
चीजें लेना माने कि
मतलब हाँ वैक्सीन, हाँ मतलब वैक्सीन लेना.
Should I get in Dr. Agarwal also been waiting and then you can add to it? Yes, Dr. Agarwal, your what would your response be to that question, that there's so much else happening, how necessary is this added vaccine?
I think as was highlighted earlier, the vaccine has been found to be extremely safe against HPV and the cervical cancer. So it's like, you take your BCG, you take your other vaccines, at childhood or after birth. So as Dr. Pankaj was pointing out, there is a reluctance in the parents for, taking their daughters for getting a vaccine at the age of 9 years or 10 years. So we have to get out of that mindset. And for that, I think a program like this one and other initiatives with the NGOs and the government of India and the state, health ministries have to take, must be taken because, I mean, you can see it, as was pointed out, that Australia has wiped out cervical cancer from its country because of the use of vaccination against the HPV. And therefore, it is time for all of us to join hands and, accept this vaccination for our daughters or our sisters under the age of 14 years. So that we get away with this cervical cancer vaccine, and that is the WHO
and
initiative.
there's no issue if you're diabetic or anything, you can still go ahead and get the vaccine.
Absolutely. Yeah, so I think the best time to get it is between 9 and 14 years. If you have missed the bus there, well then, until the age of 26, you must get that 9-valent vaccine, 3 doses, and beyond 26, one can discuss with your gynecologist or your obstetrician. You can still, up to 45 years, go for those 3 doses of 9-valent vaccine.
Right, Neeraj, I think we were discussing in the break how she's 42 and she wasn't sure whether she could go ahead and get the vaccine.
There is an HPV Awareness Day which we celebrate on 4th of March every year, and their motto is one worry less, एक चिंता कम, because they say ये बाकी सब कुछ हो रहा है जिससे आप बच सकते हैं उससे तो बचाइए, and it has no interaction with anything else. The vaccine can be given to people who are diabetic, high blood pressure, heart disease or anything. It does not cause any side effect to them. It's completely safe to give it.
Final word to you, Dr. Agarwal, if you could just, add your final message in this show.
Right. So I think this has to be a movement against the cervical cancer so as to do the HPV vaccination. And there has to be a political will which is to be taken into account. Like, for example, polio vaccine, Amitabh Bachchan ji was roped in. So you need to have celebrities, who are talking about HPV vaccine and cervical cancer, because I think the goal is very clear and you have the tools. So why should it not reach to a common, girl at the age of 9, 10 years? Because you can just eliminate it. But it has to be a movement, there has to be a political will. Society has to come together to accept the HPV vaccine. And I'm sure this is going to catch up as each day goes by.
Right, definitely, and we'll continue to try and make, create more awareness. Yes, Poonam ji, final word.
Yes. See, I would like to share from two perspectives. Being a counseling psychologist, I go and take workshops in the schools. See, schools cannot by themselves take the decision of organizing workshop on this particular issue. But then parents' workshop have become a very integral part of school. So if basically you can talk about the boards of the school, boards basically like we are talking, I'll not name any board, but yes,
the schools management, they can take it up.
They take a decision. There is adolescent school health programs where they can incorporate, it becomes mandatory to have parents' workshop where they can talk about.
And then parents can go to doctors and then you find out more about this vaccine and the importance. As we say, prevention is better than cure, and this is a vaccine that can 99% prevent a certain cancer, cervical cancer, from taking place. Well, we'll have to wrap it there. Thank you so much, doctors, for joining us, and thank you, Poonam ji, for sharing your experience with us, and Dr. Agarwal, and thank you all to the audience. Thanks for watching. Goodbye.